Hello, it's Dr. Pat with Little Critters Veterinary Hospital, and today we're doing a dental cleaning on a bearded dragon lizard. Here we're showing the placement of an IV catheter in the ventral tail vein. The tricky part here is stabilizing the catheter as it does protrude out at a slight angle, but our experienced veterinary nurses are able to handle this proficiently. He has been given IV propofol through this catheter and gas anesthesia. He is being monitored with a Doppler ultrasonic probe as well as a Cardell, which is being shown here. We do place them on a warming blanket and put their head in a downward drainage position. An endotracheal tube is being put into his airway to protect the airway from the fluids that are liberated at the dental. And we just stabilize that with a mouth gag across the tube and tape this to his head to stabilize the apparatus. It makes it a little bit harder to work around, but we feel like it's a very safe method for protecting the tube and his airway during the procedure. It's all hands on deck during a lizard dental cleaning. As you can see, we actually physically hold and stabilize the tube throughout the entire procedure, and then hand scale and remove all of the periodontal, the tartar, and the pus causing the periodontal disease. And here you can see, because of the acrodont teeth of bearded dragons, these teeth are set directly in bone, and the periodontal disease extends up to the overlying or underlying bone, where we have purulent debris or pus that has to be hand scaled and physically removed. An ultrasonic scaling alone will not remove this debris, although after hand scaling we do follow up with the ultrasonic scaling as well. Here we're showing you mandibular arcade as they hand scale and clean that. And this has already been partially cleaned at this point in the video. He is under general anesthesia still, and again his head is at somewhat of a dependent drainage angle. In spite of the fact that he has a breathing tube in, we still try to make sure that all the fluids are running to the outside of the mouth, just to ensure additional safety. One nurse does nothing but monitor their vitals throughout this anesthetic procedure, and another nurse does nothing but monitor anesthetic depth and tube placement. Generally, we have 3 nurses and a doctor working on these animals during their procedure. And here you can see that the arcade is cleaning up beautifully. Instead of the thick yellow pus, we now have clean bone and teeth.